Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a February 11th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total is above 12,000 and the new case trend line is declining, with 285 cases reported in the last 14 days. And our 14-day positivity rate is steady at about 7%. Nationally, cases have been declining for the last 30 days, but the death rate is just starting to decline and is still too high at more than 2,500 daily deaths. So why is this decline happening? Several factors are leading to it. First, people have gotten the hang of practicing mask wearing, distancing, hand washing, and staying home when sick. Second, immunity is happening due to having the disease and now vaccination by a number of people. Third, adequate access to testing and just improved general knowledge about the virus, how the virus is spread. However, this downward trend line could abruptly change depending on how contagious the COVID-19 variant strains are. Also, we know quite a few states have lifted restrictions and the required public health measures, and Iowa is one of them. If we want this decline in the new cases to continue, we all have to keep up our public health practices, even though many of them are no longer required. Remember, Dubuque County's mask requirement and the City of Dubuque's face covering ordinance both remain in effect and will be enforced. There's a lot going on right now. Vaccine administration rate is improving, additional mask guidance is out. The World Health Organization is saying it's highly unlikely any intentional release of the SARS-CoV-2 virus occurred, and Johnson & Johnson will be seeking FDA approval for their one-dose vaccine later in February. Let's talk about face masks. The Center for Disease Control and Prevention, or the CDC, released new data showing the fit of face masks, both cloth and surgical, can significantly reduce COVID-19 transmission by as much as 96.5% if both infected and uninfected people wear them properly. Wearing them below your nose, like is frequently seen, is not proper or protective. So let's talk fit and filtration. Two important ways to make sure your mask works the best it can. Number one, make sure your mask fits snugly against your face. Gaps can let air with respiratory droplets leak in and out around the edges of the mask. Two, pick a mask with layers that blocks light from coming through the fabric to keep your respiratory droplets in and others out. A mask with layers will stop more respiratory droplets from getting inside your mask or escaping from your mask if you are sick. Both cloth and surgical or disposable masks have pros and cons. The CDC website explains those in more detail. Just remember not to layer too many masks or wear too heavy of a material that cause you to strain when breathing, because this will cause increased pressure and may lead to more leakage at outer openings, especially around the sides. The Dubuque County Public Health Incident Management Team is launching a Sleeves Up campaign to encourage all Dubuque County residents to get their sleeves up and get vaccinated for COVID-19 when they are eligible, and vaccine supplies provide those opportunities. Getting vaccinated will help keep you and your family and your community healthy and safe. At 95% efficacy, the vaccine is extraordinarily effective against protecting you from the virus. And by getting vaccinated, you can help end the damage to the economy, prevent more illnesses and deaths in America, and eliminate and eradicate COVID-19. On the local front, next week, we will continue COVID vaccinations for the pre-K through 12 school teachers and staff and begin childcare workers. No appointments are being scheduled for the general public at the Kennedy Mall pod site because we are still receiving vaccine in limited amounts and are using our vaccine for these restricted priority groups as outlined by the Iowa Department of Public Health. There will be some booster vaccines, however, given to those who have already received their first vaccination at the pod site. The state and federal governments have allocated some vaccine to Hy-Vees in a limited number of pharmacies around the state, including Mercy One Pharmacy in Dubuque. Walgreens also has a limited number of doses for those 65 and over. Watch the Dubuque County Public Health Daily Updates and these pharmacies' websites for updates on the latest and greatest vaccine information. This week is Valentine's Day, Sunday, February 14th. And in case you haven't noticed, I like recognizing holidays and theme days. COVID-19 once again adds a new twist to a holiday. Distance makes the heart grow fonder has a whole new meaning with social distancing, along with virtual hugs. I think this Valentine's Day we should of course show our love to those we personally care about, but let's think a little beyond that. During this pandemic, hearts have been the symbol for showing appreciation to our healthcare workers. So this Valentine's Day weekend, I want to extend my most sincere appreciation to all the healthcare providers that have continued to provide care to us. Doctors, nurses, dentists, physical therapists, nurses' aides, just to name a few, along with all the support staff that keep our hospitals and clinics running. You have all weathered many changes and worked both long hours and shortened hours. And now, many are helping to roll out the vaccine. I appreciate all this work, as well as the incident management team, and also the dedication. So this weekend, let's all make a point to wish at least one healthcare worker a happy Valentine's Day and extend a thank you for their ongoing service. It's not just us continuing to do our part in slowing the spread, and it's not just the healthcare workers providing care. It's all of us in this together.